Good evening and welcome to tonight's annual Wade Lecture. This public lecture traditionally takes place after the Faculty of Medicine Research Conference, but in light of the pandemic, we've departed from tradition and adopted a new and more conversational format. I'm absolutely thrilled to welcome our very special Wade lecturer this evening, actress, comedian, broadcaster, screenwriter, and mental health campaigner, Ruby Wax, OBE. I'd also like to extend a very warm welcome to all our students and staff, our alumni and supporters from around the world. This evening, Ruby will be chatting to Professor David Baldwin. David is a professor of psychiatry in the Faculty of Medicine and is an honorary consultant psychiatrist in Southern Health NHS, where he leads the tertiary referral specialist service for patients with mood and anxiety disorders. Now, before we launch into the content, there's a bit of housekeeping from me. So the next hour will run as follows. Ruby and David will talk for about 30 minutes, and then we'll move into a Q&A session, which I will chair. 2020 was a challenging year. All of us faced unprecedented, multiple disruptions and felt the effects of COVID-19, either directly or indirectly in so many different ways. As part of this conversation, we hope to touch on how the adverse impact of the pandemic on individual and societal health can be minimized, particularly in young people, the socioeconomically disadvantaged and other high-risk groups, and also amongst health and social care professionals. So now to business. David will be talking to Ruby about her personal and family history of depression, her increasing interest in psychology, and her training in mindfulness-based cognitive therapy. Also her prominent role as a mental health campaigner. David, over to you.
Well, Ruby, I'd love to discuss many things with you. Some are very personal, and I'd understand if you didn't feel able to answer them, other than in broad terms, but for sure our audience out there would love it if you could be as candid as you feel able. And it struck me that it's always good, but sometimes quite hard, to start with a discussion about families.
Right.
And I understand your parents were able to escape from Austria in 1938, around the time of the Anschluss with Nazi Germany. Did they ever talk about their experience with you, or mention how they felt about being able to flee to safety, whilst others were perhaps less fortunate than them?
Well, if they had, I don't think I would be in the condition I am now. It was kept stumm. I could never watch a film about World War II because I feel I'm carrying it in my mind. I could almost hear the sounds, but they never mentioned it. And when I'd say, well, surely I must have had family, they'd say no, as if we just dropped from another planet. And finally, at the end, when my mom was really old, we were sitting in a bagel coffee shop. And I remember saying, well, where are all my relatives? And she said, they were all burned. That was the end of the conversation. I never pursued it. And then they did, who do you think you are? Yeah. So I had no information except for a suitcase full of letters and photographs where my mother looked like Greta Garbo, with different military men in Switzerland sometimes and in Venice. That could have been a movie star. She was beautiful. And she spoke 7 languages and majored in classics and got a degree in economics. I could see how disappointed she was that she had to go to America. And then my father was, well, he had to flee in a different way. He was deceptive enough to sneak out of Austria via airplane, and he had no money. The guy couldn't figure out how he got out by airplane. And then he stowed away on a ship going to America. Now that savviness is why I'm alive. And I have that push to the front, get in front of the queue before the queue throws you out. But because they never discussed it, and because I don't know if they were angry, I don't know if it made them crazy, I don't know if they were crazy before they left. I would say I'm fairly scathed by something. Who knows? There's other people who come from the Holocaust and are perfectly delightful.
Yeah.
Primo Levi.
I was reading your book, How to Be Human, and in the chapter on forgiveness, you mention a very interesting, I mean, you use a very interesting word, which is haunted. And I was wondering if you're familiar with the idea of what's called transgenerational haunting, where problems which aren't discussed in one generation are somehow transferred onto a subsequent generation.
Give me the word again. Transferred haunting.
Transgenerational haunting.
That is an amazing word. I've never heard of it. I've heard that the genes or the echoes of trauma might be carried.
Yeah.
But it's something I didn't study.
Now, forgive me if I'm being a bit clumsy, but again, when I read How to Be Human, there are several glimpses of what seems to have been quite an unhappy childhood, and I think a troubled relationship with your mother. And I was just left wondering about the expectations that your parents might have had of you, and whether, in fact, those expectations had some origin in your parents' earlier lives as well.
It's so amazing that you're hitting things on the nail, especially because I'm having a bit of a trauma now, not because of you. No. And you're banging a nail in, because I always think it's over. I'm very, I've done meditation for over 20 years. I can beat out what a shrink would say to me. I went to shrink school. It's not like I know so much, but I understand the horror show, as you say, the haunting, and I forgive it in myself and them as much as I can. So your question about, I feel like I'm escaping something all the time. I'm escaping, maybe not Nazis, but people that might think I'm inferior. That Jewish thing, maybe. So always proving a point, and it's never good enough. I get it, with my background, if I had the genes that were more resilient, it might not have affected me, but bingo, I won the lottery. So yeah, I am disturbed. I did the best I could, but there is never an end to when I go, phew, you're safe. And my dad, when he got to America, he never felt safe either. He was vengeful to the end, and he would screw people way before they screwed him. And his business ethos was, I think somebody who worked with him once said, that scene in The Godfather where they leave a horse's head in the guy's bed who pisses him off? He said, that's your dad's idea of a greeting card.
Thank you.
I came from, these were pushy parents, and I could have gone either way. Yeah. And I think I went both ways.
Yeah. The last thing I wanted to ask about your family, if that's okay, because you've mentioned the Who Do You Think You Are program, and your discovery of some more distant relatives and problems that they had experienced. And I just wonder what it was like for you in sort of uncovering this concealed family history of, I suppose, psychiatric illness, although of course it was a very long time ago and you never know for sure. But I was wondering what it was like to have that revealed at this stage in your life.
Well, how interesting. When I was in 7th grade, I stole a book from the library called This is Mental Illness, and it's always been my fascination. Yeah. And even when I interviewed famous people or whatever, I saw them as a Rubik's Cube, and I would figure out how I thought their mind worked, what was the puzzle, always looking for the black box in the plane crash. And suddenly to find out that I come from a long line of madness, and it is, you say it's far away. My cousin killed himself on my father's side. You didn't get to my father's side, the suicide notes. I think I married my husband because I checked it. There was no insanity as far back as I could see. They were in the military, which
Yeah.
you'd think would drive them crazy, but they could take a bullet. Um, and so it is an incredible coincidence, or
Yeah.
maybe not, that I come from that. But when I went to the mental institutions,
Yeah.
to both my great aunt, my great great aunt, I kept saying, weren't they actresses? And they kept saying, no, they were an insane asylum. And I'd say, well, were they actors some of the time? I had it that I came from a long line of actresses. I said, was there a drama group? Anyway, there were people still in the institutions, and
Yeah.
I felt so at home.
Yes.
You know, this is where I really feel I'm with my people. We didn't even speak the same language, but
No.
I'm close to these people, and I feel closer to people with a mental health issue than I do with my family,
Yeah.
except for my kids and my
Yeah.
husband. But you know, I
Yeah.
have more in common.
Now, again, sorry if this is upsetting, but you know, you write a lot about your experience of depression and of the depression sort of recurring over time. And depression is one of those words which kind of means different things to different people. So I was just wondering, could you tell me and the audience out there what it's like to be you when you're depressed? You know, what can't you do that you can do at other times? How does it feel to have that experience of depression?
Well, I could ask you the same thing. What do you feel like? Do you
Yeah,
remember?
nicely turned. Yeah, I mean, for me, it was, there were some things that I could still do. So, you know, I could still run a clinic and I could still supervise junior doctors, but I couldn't do things like write a paper or prepare a grant proposal. And I found myself kind of less interested in keeping touch with friends and family, and concentration was really poor. I mean, that's before I started treatment. How about for you?
Um, yeah, I don't, it's such a slow burn that it's, who was saying before, it's like your temperature goes up so you don't realize how ill you're getting. It's so subtle. And then you're sitting in the middle of it and you think, because I'm having a little bit of one now, which I haven't had for 15 years, it feels like that I have a bit of dementia because I can't remember anything. I mean, tragic things. You put down a pen and that pen's gone. And it starts off quite small, but if it led to depression, which I don't have now, if it led to depression, you would have a soundtrack in your head that was not sad and it wasn't anxious. It was just white noise. It sounds like Austria, probably. It's 10,000 screaming voices, each one telling you to do something else. I always say, I made a thing, I said, if the devil had Tourette's, that's what it would sound like. And it doesn't let up. And so you end up just sitting on a chair, gormless. That word they used on me a lot. You look gormless. And so you don't know whether to turn right or left. A shower is inconceivable.
Yeah.
And all you are, finally, if you're lucky, around other people with mental illness, and you can repeat as many times, they don't mind saying, is this ever going to end?
Yes.
Is it ever going to end? And then when it's over, you cannot believe
Yeah.
that you were so vacant. You did not inhabit your body. You were the mind went. So
Yeah.
you're just a carcass with some movement in it.
Yeah.
I couldn't read.
Okay.
And,
Right.
yeah,
Yeah.
you could eat.
Okay.
Yeah.
And I mean, one of the things that people like me always want to ask when they're seeing someone who describes recurrent depression is, have they ever had the opposite? You know, have they ever had periods of really marked elation or feeling, you know, high as a kite with lots of energy and ideas and increased creativity? Because, you know, that would make us wonder whether or not someone had bipolar disorder. And I was wondering, have you ever had such an experience?
You're so on it. You know, my shrink, who many years ago, I haven't been tested for about 12 years with my medication, said that if you have more and more episodes, chances are the depression might start slipping a little bit into bipolar.
Yeah.
So I have lamotrigine to deal with that. Okay, just recently, I've become quite, I wouldn't say, let's say over efficient. I don't have the depression, but I'm over efficient. Let's just put it that way, to the point where the obsessions are starting. Now, this only happened a week ago. I said, is this mental illness again? Because I'm not, I'm not in that gormless state. I'm the other way. I don't do things that I remember Stephen Fry saying, that suddenly, you buy 8 cars and set your hair on fire.
Yeah.
But there is impulse shopping.
Okay.
And my daughter's birthday was on par, I don't know why I'm telling you this so honestly, with getting some Clorox. So I would say I'm kind of in a manic.
Okay.
This is one of my first visits. So it's
okay.
what a coincidence you're talking to me.
Okay, well, thank you for sharing.
And maybe
that
when we're finished, I could just run through what my medication is and your
that'd
thoughts on it.
Why not? That would be a pleasure. I mean, there's actually about a 1% risk with each passing year of switching into bipolar disorder. So, if you've had recurrent depressions over 20 years, then there is roughly a 20% chance of developing bipolar disorder. Yeah, it's a fairly constant figure.
Thanks for giving me the news.
Yeah. Okay. Now, in How to Be Human, you mention a number of drugs by name, antidepressants and other medicines. And you also refer to, using your word, being institutionalized. And I'm just wondering, as a user of mental health services, do you think that pharmacological treatments have been helpful to you?
We'll never know. How do you know if it's a placebo effect or not? I mean, how do you know when you get chemo that's what made we don't know. But I know that it's in the foothills. We're in the dark ages as far as medication. And I love the analogy that if something's wrong, they set a whole forest on fire to get at one tree.
Yeah.
It's all I've got. I'd be scared to cold turkey because I'm scared of mental illness, and I haven't had it, as I say, until today. Not the depression. I haven't had it for about 12 years.
Yes.
Maybe even more, where it was so bad, and that's when I decided I would learn how to maybe self-regulate or be able to tell when it's coming, because forewarning is everything. And I did study mindfulness.
Yes.
At Oxford and blah. And there's forewarning. There's such great forewarning that I haven't had it, probably because I knew when I could hear the tiny footsteps to shut off social media, to check into a place where there's no noise. I knew how to take care of myself, because before, my tendency as it is now is to, of course, I'll do an interview. Of course, I'll write a book. Of course, I'll do that, because you're so ashamed about something being wrong. You'll pack it in. Meanwhile, you're flooding now. So I've waited that long. Now I know, cool it, Ruby, you're going to go to the wall. So I do believe in psychiatry. If you have mental illness, if you're just anxious, I think it's criminal that a GP would give you antidepressants. I think it's criminal. But who's doing the call?
Yeah.
If somebody was schizophrenic, would you confuse that with anxiety? And depression is just as legit. Yeah.
Thank you.
I think the word is so upsetting, depression. It sounds like you're depressed.
Yes. And I think that's one of the problems, isn't it? It's a word that we all use to describe even very transient states, whereas actually a depressive illness is something that's very different indeed. Yeah. Now, I wanted to move on to kind of more positive things, I suppose, which is that, you were obviously drawn to mindfulness approaches to managing mental health problems. And you have this postgraduate qualification in psychotherapy and a master's degree in mindfulness-based cognitive therapy. So what led you to become interested in mindfulness? And how do you use the insights from mindfulness to managing your everyday life?
Well, as I say, I did a lot of research. I'd done therapy for 30 years. It's wonderful to get a narrative together, to make sense of the chaos, but eventually you're just telling the same story over and over again, embedding an autobiography that might not be the actual truth, but here's the story you pull out, and I think that's very limiting. And also it's imprisoning. So
Yeah.
mindfulness, never heard of it before, and cognitive, which they didn't even let me study when I went to school to study for psychotherapy. That one was left off the agenda, said had really impressive results. So then I found Mark Williams, who was one of the founders of mindfulness-based cognitive therapy. He was a professor at Oxford, and he took pity on me. He could see I wasn't well. It was in the middle of the worst depression. And I said, please help me, but tell me what goes on in the brain, because I'm really practical, even in my illness. I don't want to give time to things that are new age. I don't want to give faith to things I can't see in a scanner. I know you're looking at a mind might be also a concept, but it's good enough for me. So I got into Oxford to get my master's, and I picture what happens in my brain whenever I sit. I mean, that's not for everybody, but just as, when you do sit-ups, you notice there's a six-pack coming. I have to picture that my insula, which is part of for interoception, each time I do even a minute, I do more than a minute, that's getting more and more buff. And when it gets buff, it's easier to take the blows. It's easier to observe thoughts. And that's a counterbalance to the amygdala being hijacked.
Right.
You still get fear. You need that for protection, but I can get my rage down quicker without suppressing it, just by being kind and saying, okay, Ruby, it's a trigger. Come on, pull back. I have learned to be nicer to myself. Yeah. And my disease is a disease. It's nothing I've done wrong.
Yeah, absolutely.
So I got that from mindfulness.
Yeah, absolutely. And one of the things that always impresses me about mindfulness-based cognitive therapy is its long-term effects in reducing the chance of depression recurring. Do you think that's been the case for you, that actually undertaking these mindfulness approaches on a kind of daily basis has acted as a buffer against depression returning?
Well, I'm also on medication.
Yes.
People go with it. Why would you do well, I'd say if medication worked, why would I have relapses?
Yes.
So if you're talking about, it might be more than 15 years of being able to notice when it's coming, turning off everything to do with social media, telling my work I can't do it now. So the depression is agonizing. It is, I think, passed after 5 days rather than 5 months.
Yeah, got it.
It's not like, oh, now it's, now I'm in bliss. It's still agonizing, but it's recognizing it.
Yeah.
So yes, I would say it held it off.
Yeah. So in your case, it's the combination of a psychological treatment, the MBCT, with the lamotrigine in terms of helping you sort of ride the waves. Yeah, got it. Thank you. So as Chancellor of the University of Southampton, you'll be well aware of the difficulties that our undergraduates and postgraduates experience, even at the best of times. And of course, all normal stresses and challenges have been amplified by the pandemic and its restrictions. So how do you think mindfulness-based approaches could be used to benefit our students and maybe our colleagues in the university?
It's not for everybody. So to say everybody should try yoga, what can I say? Somebody will break their back and somebody else will be able to tie their foot in a knot over their head, and somebody else will get some benefit. But with mindfulness, it isn't something new age. It's actually very logical, is that you are training a part of the brain just the way you are when you're doing a sit up, to be able to, as you can see in a scanner, probably not with everyone, but better results than most.
Yeah.
Praying also had a good result. So I think, look, it's not going to make the pandemic go away, but the things like uncertainty, loneliness, panic, whatever, mindfulness stops. I call it the frazzled effect, which is these are on the human palate: fear, anger, uncertainty. But the new phenomena, and I do a show as to why that is, and a book, is that we're stressed about stress or anxious about anxiety, as if we shouldn't have it. Like, oh my God, nobody else is this stressed. Why should I be stressed? I feel terrible because I'm having a good time during the pandemic. We cannot let ourselves get away with anything. There's a critical, reviewer up there who's just, and we can get into why, but humans have more negative thoughts than positive, that. It's just they're coming in hot and heavy because the news is on the whole time. Our amygdala can't tell if there's danger behind us or something's happening 20,000 miles away. Data hackers know how to capture our attention, so we can't even sleep because they know what we want more than we want. I'm not blaming the world. It just happened. We created this culture and now we're victims to it. So we have to learn a kind of braking system.
Yes.
Now, either you go to church, or you have a family unit, or you sit with your tribe the way they did around the fire, or you join the Quakers, or you go to a town hall meeting, or you do charity events, which I learned from my new book, How to Be Human. When you face the real deal and you're filled with that love, believe me, the cortisol goes down pretty quickly. But, so it isn't all mindfulness, but mindfulness does train self-compassion.
Thank you, Ruby. This has all been absolutely fascinating, and I imagine will stimulate lots of questions. So I'm now delighted to hand over to our Dean, Professor Diana Eccles, who'll be chairing the question and answer session. So thank you so much, Ruby.
Thank you. Thanks, David. You're doing great.
Thank you, Ruby and David. That was fantastic. And there's been the most amazing feed of questions. I can hardly keep up. I'm feeling quite breathless, but I'm going to do my very best to put. So my apologies to the audience if we don't get to your question. There are literally so many questions. It's hard to pick. So I'm going to start with a fairly straightforward one, hopefully, which is from Andy Wareham. And Andy wants to know, what do you do personally to try and remain positive during lockdown?
I don't know what that word positive means, unless you're kidding yourself. I think positive is a lot of pressure, especially for somebody with a mental pathology, because it always makes you feel like, how come I feel, I really, words like happy and positive really disturb me because I feel like I'm not a member of that club. But, there's a moment where you feel solace, I suppose. And I'm sure religion gave that to a lot of people, but I know we're going to talk about it later on, but I run something called Frazzled Cafe, where ever since the pandemic, I had about 100 people a night. I did it every night. Now I'm down to 3 times a week. I can go more into detail, but I have, it's been going on for 4 years, but I'm now doing the Zoom at 5:30, now 3 times a week, and people speak from the heart. It's a little like AA, but it's for people who are frazzled, which pretty much is everyone. And we get people from all over the world and all ages, and it's got a format. I begin and end with mindfulness, but then they speak from the heart. We don't allow you to talk about the news, and it's not therapy. So we say, if you're really in trouble, we'll tell you places you can go. But this is just the human race, being honest and authentic. And whenever I get off one of those meetings, every time I run a meeting, I'm just, I'm oozing with compassion because they're sending it back to me. I mean, I never thought we'd have a day where technology would provide us with a space where our hearts would engage. I always thought that oxytocin passing thing, you had to be skin to skin, but look at this. And people who are on my Frazzled Cafe say, I'm practicing doing this Zoom so that when I go out in real life, I'll know how to look at people in the eye and I'll know how to listen and try to imagine their lives. So in a way, we should have been trained in this a long time ago. So that's what gave me solace. I wouldn't say positivity, but I'd say it would make me feel like I was part of a community.
I guess we've got another question from, and I think that maybe partly answers that, given that we've started engaging with Frazzle Cafe at the university. But Joe Fish from the School of Biological Sciences asks, inevitably, we're headed towards a crisis with mental health because of the last year we've had. How do we as a university community help ourselves and help each other?
I'm not we can only do what we can. You know, I don't represent a university or a religion or a political movement. It's each man for himself, really. I mean, if this is where mindfulness is interesting, unless you can cool your own cortisol down, cool your system, you won't be able to think clearly. So nobody can help anybody until individually we learn how to kind of self-regulate.
We had a question earlier on about post-traumatic stress disorder, PTSD, and the fact that it can sort of come over you abruptly and suddenly, and then be with you for a very long time. And I think the suggestion in the question was that once you have it, it unfortunately tends to persist forever. And actually, that isn't the case. When you follow up people with PTSD, a very significant proportion actually get a lot better within 18 months. So, 18 months is a long time, but actually don't get disheartened, because the natural history of the condition as a whole is that it does tend to resolve. The important thing for people with PTSD is, wherever possible, not to develop additional problems such as depression or alcohol abuse or substance misuse. So to trying to keep it as much as possible just the solitary condition and avoid these comorbidities. And if that is the case, then with time and support and treatment, actually the majority of people will have an improvement. Okay, I could ask some more questions whilst we're waiting for Diana to come back in. I saw an earlier question from Professor Pritchard about families, Ruby, and what can be done to support the families of people who have mental health problems. I wonder what your thoughts are on this.
Yeah, I mean, the family member, the caregiver almost has it as hard as the person who's suffering. People always say, what can I do? I don't know what your feelings are, but you can only love them. But don't say perk up, whatever you do. Don't say perk up, because, they say that to depressed people. Because, you go, oh, well, I never thought of that. You can gently say, would you like help? Because, what a wonderful thing. Then you could take them by the hand and get them to somebody who knows what they're talking about. Because I always think it's strange when you have a mental health issue and you go to a shrink, how do you know what they're doing? Yeah. You're the last person to know if they're doing a good job. So it's always better to have somebody with you. They can take you to, go to 12 GPs until you feel it's right. But if people really resist it and say, I don't want your help, because there's so much shame, as we know, shame comes with the package. It's like if somebody's an alcoholic, you can't drag them there. And that's terrifying. If you're the mother and your kid doesn't want to see anybody, I mean, you'd be paralyzed. I don't know what to do. But I think it would be great if they had a group that, how bereavement groups meet. I wish there was a group where parents or, siblings would meet who have somebody that they need to take care of, so they could compare notes. That doesn't
Thank you.
exist.
We had an earlier question from Maxine Howe, which was, how do you differentiate between mental distress and mental disorder? And, and of course, that's often really, really difficult. I mean, I know how I do it or try to do it, but Ruby, what are your thoughts about this?
I want to hear you. You go first, David. What are your...
Well, the important thing is not just about symptoms, you see, and there's a problem with psychiatric practice if it's kind of reduced to just symptom counting. And you think, someone's got 5 depressive symptoms and they've had them for 4 weeks, then they might have such and such a diagnosis. And that's not really the way to do it. You need to think about the degree of distress and the associated impairment, I suppose you might call it the disability, the fact that you can no longer do things that you used to be able to do when well. And people should always be asking about this impairment due to symptoms. And, you know, symptoms which are mild or transient, you don't need to be using psychotropic medication or even specific psychological treatments because, you know, things will get better. But if there's very significant distress and associated disability, then it's likely that people will need some form of targeted intervention, whether that's medication or psychological treatment or the combination of the both. But Ruby, I imagine people ask you this question quite a bit.
Again, well, they ask what's the difference between being frazzled and having a mental illness. Are we allowed to say mental illness these days? Well, to me, you'll probably or people will disagree. It's like being pregnant and not pregnant. I really, there's a moment something becomes cancer. I mean, and you have cancer. Otherwise, there's just cell division. There's a look in the eye of somebody with depression that cannot be replicated in somebody who's just a little or a lot has a lot of anxiety or panic or whatever. There's a deadness in those eyes. You know, it's like it's dead, your hair's dead, your skin's dead. I wish the teachers would understand, look in their eyes. That, you know, your skin changes. So I really think mental illness is a whole new ballpark. From just the general anxiety. I mean, you can get traumatized at any moment, I know that. But with depression or schizophrenia, I don't think it's just because you're having a bad hair day. But as you were saying, when you have it, you're the last one to know that you have an impairment. Because I know you'll know, it's like when you're ill, you think, oh, this is the new personality. I see, I can't go to the bathroom anymore. And then you're so ashamed because you assume, oh, this is just what I've become. You don't think, oh, this is temporary, it's going to go. That's why you get depressed people going, is this going to end? Is this going to end? Because you just assume, oh, okay, I've suddenly turned into a blonde overnight. So it's hard to know what's different.
Thank you.
And what's permanent.
Diana, are you able to come back in?
I am, yes. Thank you very much. I'm sorry. I don't know why that dropped out. I do apologise. I hope I obviously missed a little bit of it, but I would just following on from that conversation, which I was listening to, and there's quite a lot of questions coming through from people who are saying, if you see a colleague or friend or family member who you believe is depressed, how do you help them? What should you do? What would you do to try and spot it, but B, help? Given what Ruby was just saying, that people often have the person who is becoming mentally ill is the last person to realize it very often.
I think we were just saying that. I think if you're a work colleague, don't go up to them because they'd be terrified that they get caught for being mentally ill. So maybe write an email. If you're a parent, I don't know what you do. You know, if you have a good relationship, the kid will say something's not right. And then maybe you can help them. But, you know, you have to spot it. A parent has to be in the right mind rather than suddenly projecting your horror of mental illness, especially if you've got one, onto your kid. But you have to start to really look closely. Is this anger? Is this puberty? Or is this mental illness? And if it is mental illness, I say, get thee to a psychiatrist pretty quick. I don't think it's, oh, I'm just going to bite the bullet.
Yeah.
You know, for diabetes, I take the insulin. So as I said before, how do we know if medication works or not? But I'm not gambling on it.
Yeah. David, what would you, in terms of just to round that up?
Yeah, I mean, I think it's helpful to be familiar with symptoms which are associated with the phenomenon of depression, because depression means different things to different people, as we talked about earlier. So, you know, if someone's talks about being unhappy and miserable and tearful, you know, it should be okay to ask them about other things like sleep and energy and concentration. We should have a greater literacy at the population level about common psychological symptoms. And then it should also be okay to say to people, well, I wonder whether maybe you've thought of going to see a doctor or a counsellor. I mean, I think we all need to just increase our literacy of common mental health problems, and that should be supportive. We found that some 30 years ago, at the time of the Defeat Depression campaign, that it was possible through public education work to increase people's understanding of depression and to change attitudes about depression and treatments for depression. So it's doable, but it does require concerted campaigns to be able to do that properly.
Excellent, thank you. So we've also got a few questions around this, but Maria Baker, for example, says, Ruby, what has been the most useful tool that you've discovered to use in times of stress when you feel that depression may take hold?
Well, people say, what's your top tip? Or, you know, and I'm not saying you're saying that, or what do you know, you have to practice something in order to be able to deal with it when it hits you in the face. You know, if you don't go to the gym and get a bicep, you'll never be able to, you know, catch the other acrobat or whatever. So the reason I do mindfulness is you're getting a muscle ready for me. I'm not just doing it because I had nothing else to do that day and thought I'll just follow my breath. I'm doing it so that I have this resilience and this ability to do exactly what we were talking about. I can actually hear, I can observe my thoughts. Now that's, people go, how can you do that? I'm not going to go into the technology of it, but you can start to feel the weather conditions, and I can spot an early warning sign that this is depression. This isn't just a bad, you know, I'm having a bad experience. So that's why I do mindfulness. And I don't know where people think, oh, well, here's my trick. This is what I do. I do mindfulness so that I can catch myself. Then, of course, there's other benefits, because one of the exercises is to strengthen a part of your brain that can help you pay attention. And to me, if you want to, attention is the road to happiness. And people always go, it's such a lightweight word, but you know this, if you can, there's some great quotes about it, but I don't know. But, you know, if you can take your focus where you want it to be and not be dragged into this kind of loop tape of distraction, well, there's a life, you know, that'll make you happy. But of course, this does not prevent depression, this mindfulness. It still comes, but it means that I don't get depressed about depression. It stayed 14 years ago. I only had it for 5 days rather than 5 months. So it's worth it. It's worth sitting every day for however many minutes I do it.
And it's also worth actually highlighting the work that goes on in the School of Psychology here in Southampton with Matt Garner and his lab, because he's explored in detail things like the relationship between attention control and ruminations and mindfulness. And by enhancing attention, you can increase mindfulness and vice versa, but also reduce negative ruminations. And it's those ruminations, that looking down and inward rather than up and outward, which is so destructive. So through enhancing attention, you can reduce ruminations and improve mood.
Yeah, well, attention would pull you out of the cycle.
Yeah.
Otherwise, you're just in the spin cycle. Yeah.
So
what do you pay attention to? Well,
that sort of leads on a little bit to this next question. So this is from Francis, who's an occupational therapist, who wants to know whether you feel it's important to have a focus on meaningful activity as a way of helping you well-being. So I think that means physical activity, purposeful physical activity.
One shot. You want to go first, David?
I think it does. I remember exploring resilience in quite a lot of detail a few years ago. And certainly things which enhance resilience are a sense of meaningful activity and of connectedness and strengthening of one's social network.
Mm.
All of those things enhance resilience. So, you know, the work of occupational therapists actually can be really crucial in enhancing resilience. So it was a great question, and thank you for all the work that you do with our patients.
I've got a question from Ian Wright, who thanks you very much, Ruby, for speaking so candidly. Many people in the world are experiencing trauma due to the pandemic. With your history, how are you managing your own emotional reaction to the pandemic?
Well, I said, I mean, I don't want to go over it again, but I thought community was important, which strangely enough is part of the reason we're so, the next pandemic just might be mental health, is because we're not used to isolation and human beings don't flourish as in, you know, stuck in rooms. And so I did create a community, maybe selfishly, which is my Frazzled Cafes. It's more for me than even for them. They say thanks. I go, no, you don't know what it's doing for me. That's what I do. I mean, you know, I could say I run or whatever, but it's got to be something that warms your guts, you know, and so that's what does it for me. Yeah.
And it'd be different for different people, presumably. You have to find what is
well,
your.
I'll tell you something. Most people need other people, you know.
Yeah.
Isolation is one of the biggest killers and causes of mental health. So it isn't up to the individual. That's just the way how humans roll. We really do need each other.
Really
out of the woods.
That community. So a little bit related, has asked whether you think there's a link between the onset of your depression and burnout.
David,
I guess
first, I don't see the, you know, as you know, if you have the genes for depression and then mix it with a, you know, an unstable background, or think bingo, you might have won the lottery. I think if you don't have the genes, you could really suffer a lot of anxiety and really have the worst parents on earth, and you'd still be okay. I mean, it is Russian roulette. So burnout is something we can all do to ourselves, and we live in a culture, if you're not burned out, something's really wrong with you. But depression is the 1 in 4. You know, I wish there was enough money that was put into neuroscience so that we could say, oh, here's where it is, just the way we can spot cancer. Somebody said that Bill Gates, if they put as much money into malaria as they had, you know, into brain science, we would know more about depression and maybe even have a cure. But, you know, I'm not going to be bitter.
Here's a good one for you from Ben Hyatt. What would be the one book, the single book, it's a bit like Desert Island Discs, that you would read to start learning, or you recommend reading, I guess, to start learning about mindfulness and cognitive therapy?
Well, my professor at Oxford was Mark Williams, so he's the father. Then I took his ideas and I spun him a little bit into comedy, which was a mindfulness guide for the frazzled. But I didn't go so far off-piste. But I did make it more practical, so you can do it while you're, you know, sitting in a bus, at the gym. You know, I'm trying to break it. Mindfulness is not something where you have to sit on a gluten-free cushion. As a matter of fact, oh, sorry, can I say something? I'll be teaching mindfulness online starting on February 8th. I'll do an hour a week, which is the first time I've ever done this. And it's about time, because that's what I studied. And if you want to do it, you go to the mindbodyspirit.co.uk. So I'll be teaching mindfulness.
I could recommend a book, which is this, actually.
Well, the book about mindfulness was a mindfulness guide for the frazzled.
But to be honest,
any of them, because it'll help mental health.
I mean, this is a fantastic book because, I mean, it's, you know, describes Ruby's experiences, but there are practical exercises in it, which are really well described and very funny. and actually, I think, really good to do. So
yeah, commission day. But I think that sounds like a great. So I'm going to.
But the great book and the guy who invented it or brought it from the east to the west is Jon Kabat-Zinn, who, you know, was a molecular biologist, and he worked with mindfulness with people with chronic pain. So that's where it began. And I met John, he's as good as it gets. He brought it to it, he invented it.
It is a timely time to thank Ruby enormously for her her brilliant contribution tonight, and David for the conversation and helping with the Q&A and just a fascinating discussion. I'd like to thank all of you for joining us tonight, for your interest and support of the University of Southampton. So without more ado, I would wish you all a very good evening, and thank you for joining us.